Hello, Dom the Pharmacist here, and I want to talk to my fellow healthcare providers. Why aren't your patients taking their medications? Why aren't they doing what you are talking about in those encounters? I'm seeing how these patients are coming home from the hospital. They just had a huge admission for something huge. They just got diagnosed with heart failure, and now they have 5, 6 new medications, and they don't even know what they are, why they need to take them. And they also have this belief that they don't need all of those medications and that they're fine without it, and that the doctor is just trying to put medications on me to make money out of me. This is what people are thinking. Let's get into the brains of our patients. If we can get inside of their world, we can actually do a better job at handling them as an individual so that they actually improve. I want to go through the different things that you should be considering as a provider when you are dealing with patients that they're just not seeming to get on board with you with what they need to be doing to take control and to be responsible for their own progress in their disease states. If you are starting a medication and you're not going into what it is, why it's important, and what's going to happen if they don't take it, the patient is not likely to follow through. You're not really setting them up to be successful. You're just writing another prescription, telling them that they need to take it once a day or whatever that is, and you're just assuming that because you told them to take it that they're going to do that. People need more incentive than that, especially when they're trying to break through the barrier of distrust. So if you can spend that time, or if you can find someone in your practice where you can refer them to have that time set aside for more in-depth education, or you can have the office find a way to get pamphlets and patient education pamphlets and then encourage them to call back if they have any questions. Another thing that we need to be considering is their barriers to healthcare. What is their financial situation like? What is their transportation situation like? What is important to them? Are they a caregiver in the household and their health is not the priority right now? They're concerned about the other people that they have to take care of. We need to get to the root of the issue, because if you're dealing with somebody who just is not prioritizing their care, you can keep adding on and trying to fix all the things with medications, which is polypharmacy and is also going to cause other issues. But if we're not really taking that time to sit with that patient and explain, hey, I know that you're taking care of your daughter or your mother right now, and that is your main concern. But if you don't get a charge of your own health, you won't be able to be here to live and see that they are tended to and that they are taken care of. If you're worried about their health now while you're here, what happens if you're not here and something happens to you because you didn't take care of yourself? So we have to have these types of conversations with patients. And sometimes it can feel like we're crossing the line because now we're getting into their house or their home. But medicine is personalized. It should be personalized, not just personalized with their body system, their age and their disease states, their organ systems, not personalized in that matter, but also the external factors that are going to play into what they're going to do when they go home, or how their life works when they're not in your clinic, when they're not in your office. All of these things have to be considered. So please take some time. If you're starting them on a medication that requires them to get regular monitoring and more frequent labs and imaging, ask them if they're able to meet that requirement. Have that conversation, because if they're not going to come into their labs, if they're skipping their appointments for follow-ups and labs, it may not be because they're not invested. It may be because they don't have the means. So let's dig a little deeper. I want to talk about how we can kind of sift through the patients who are being honest and transparent in the appointments versus those who are saying, yeah, I'm taking my medication, and they're not. Or they say, yeah, I take it every day, and they're not. I'm going to tell you as a pharmacist that I will go and see a chart in a regular routine or primary care, follow-up visit, whatever specialty, and there is no indication in that patient note or that encounter note that the patient is missing medications. But I can clearly see by how frequent they're filling their medications that there are gaps in their prescriptions. There are gaps in their refills. Those gaps indicate that they're not taking their medications the way they're supposed to be. You can pick this up though in the conversation. I do telephonic interviews at this time in my current position, so I have to have a very attuned ear to hear for discrepancies in what a patient is saying, even when I'm visibly seeing their fill history on the screen. So what I'm listening for is kind of like the pauses in between their medications, or I'm asking questions open-endedly about how they're taking their medications, because I want them to tell me how they're taking it. Because if I tell them, they're just going to hit me with a yes or a no. And the point isn't to check a box and to get through the med rec frequently. What's the point of doing that if they're actually not doing it, and then they're back in your office or back in the hospital? Or even worse, you get a notification that your patient is now deceased because we didn't take the time to do what really counted, and to make sure that they're actually doing what they're supposed to be doing at home. When you hear them stuttering, hesitating, oh yeah, I take that one. Sometimes when I hear stuff like that, I'll ask a follow-up question so to make them go a little deeper into that medication. And when they can't answer that follow-up, that's my indication that they may not even know what this medication is or if they're still taking it anymore. They're just saying yes. Patients, a lot of them, don't want to let on to us as providers that they're not familiar with their medications. Some of them feel ashamed that they don't have the knowledge. They will just default to what feels easiest and default to what has less shame and less judgment. And that's just to pretend like everything's okay and pretend that they've got it all handled and under control. So we need to be mindful of this, and we need to make time. We need to use our emotional intelligence in the matter and pick up when things are not okay. And if you see that the fill history is off, you need to verbally point to that in the conversation. Oh, okay, so if you were taking it every day, it looks like you would have been out by now because this prescription expired 2 months ago. That's a red flag. So have these conversations, say it with love and say it with gentleness. Don't accuse them in it either, but just kind of try to fill in the discrepancy between what you're seeing and what you're hearing versus what they're saying, what they're actually saying with their words. Because there's more to communication than just what we say. There's how we say it, our body language, if they're looking nervous, if they're fidgeting if you can pick up on these things that indicate that they're not quite as informed or on top of things with their medications as they may say that they are. The last nugget that I want to talk about here when we're dealing with patients and when we're educating them, when we're starting things, let's start encouraging our patients to bring in a notebook or a notepad or a family member or friend, somebody or something that's going to help increase the chances of them actually remembering what you're talking about in that encounter so that they can go home and do it. Because even if they remember what you're going to say, by the time they get home, their recall is going to be very minimal. And then what they actually recall as to be accurate is going to be even lower. That's something to make us change the way we're delivering medication information, disease state medication information. Let's actually start encouraging our patients to, next time you see me, I want you to bring in a book so you can write down what we're saying. Next time you see me, I want you to maybe record this conversation on your phone or bring in a phone recorder so you can record what we're saying so you can play it back later. Next time you come in, if you have a family member that can accompany you who can also write something down while we're in the meeting, so that you can remember what we're saying, because they're just not remembering. They're just not remembering. And then the older that we get, or the more things that we have going on, even if we're young and we have a lot of stress going on in our life, our memory automatically is going to be impacted by that. So let's advocate for them to bring in things to their appointments to write them down. And let's advocate that they journal things when they're home, tracking their conditions. Don't just tell the patient to measure their blood pressure one every single day or 3 times a day, wherever it may be. Tell them to measure it and measure it around the same time of the day and to record it in a book so that they can track it. Let's start putting in and advocating in practical things that they can do to increase their ability to understand, to define trends. And guess what? When they bring in these journals to you, you actually have data to work with and you're not going off of their memory alone. You have real data that you can use to make a justified and your best informed decision. These are things that I think we could just be doing a better job with as healthcare professionals when it comes to our patients. Let's stop relying on the fact that they should be doing this and they should have known better, and if they cared they would do this. Let's cut it out with that. Let's remember why we became health professionals in the first place. We're not just here for the people who have it all together and who are going to be on top of their health. We're also here for the people who are struggling, for the people who still can't read. And also, let's consider that the literacy rate of the country is dropping. It's not going up, it's dropping. Let's consider the people who have barriers and socioeconomic factors that are becoming a challenge for them. Let's consider all the things that play into a patient's well-being and their decision making. Let's not just bring the book intelligence into the patient interaction. Let's bring the emotional intelligence. We can get so caught up in, I have so many appointments that I have to get through. I have to meet this 15-minute mark, this 30-minute mark, and then I have to do all these notes, and then I have to, and then I have to, and then I have to. Who cares how many patients we get to see and that are on the books if we're actually not making people healthy? Let's get back to the root of it. Let's fall back in love with it. Let's take a little extra time. And if we really just don't have the time, maybe we can talk to management about other sources that we have in the office where we can still provide some aid for our patients. Let's make a way out of no way. I know I sound like a big dreamer right now, but come on, guys. Let's work together to do a better job at this, because patients are falling through the cracks. They are falling through the cracks. I challenge us as healthcare providers to think about this, and I'm giving you this information from the pharmacist perspective. And if you haven't been utilizing your pharmacist yet, if you still have not been convinced that pharmacists are helpful to you and what you're doing, maybe this video is a consideration of, maybe they do have some input and some wisdom to impart on my behalf. If you have a pharmacist, use them. You are the doctor, you are the nurse practitioner, you are the physician's assistant. You have put in the work, you have fought the good fight, you have your degree, you have the knowledge, you have the experience, but you may not ever accumulate the precise and the detail-oriented knowledge about medications the way pharmacists are trained. You may be thinking about one condition and making sure this patient gets treated on one condition, but there are 5 other conditions that you're not considering that patient has, that if you start this medication that helps that one that you're focused on, that it actually is going to impact the others in a negative way. Now you're going to have issues over here. You want to think about, you have this new symptom that started. Maybe the symptom they're reporting is not because their disease state is uncontrolled. It's because the medication you started now is having a side effect. And if you don't talk to a pharmacist, you're going to start another medication to treat that side effect, which is going to cause more side effects, which you're going to treat more polypharmacy. And then we see increased hospitalizations. Then we see pill burden forming. Then we see confusion increasing. Then we see a decrease in patient compliance because the complexity of their regimen is increasing. So please utilize us as pharmacists. If you're a healthcare provider and you're already using your pharmacist, can you comment and shout out your pharmacist about how much they're helping and just taking the weight and the load off of you? We're not here to replace what you do. We're here to be in addition to what you do, to make your job easier, to help you catch the things that maybe you weren't so focused on in your curriculum or your training, or that you haven't come across in your experience. We're here to work with you, not against you, and we're not here to take your job or to step on your toes. But I do have to say, we are highly qualified to do what we do. We have gone to graduate school the same as you. We have studied these medications. This is exactly what we were trained to do. We are here for such a time as this. So use us, rely on us. We are here to help. And there is studies and data to show that having a pharmacist on board of a multidisciplinary team increases patient health substantially and decreases healthcare spending due to unnecessary med errors and poor outcomes. So let me know what your thoughts are. And I hope this helped. I hope it gave you something new to consider. Stay blessed and stay curious. I'm out.